Good morning.
Good morning.
How are you? Good?
Yeah, and I think the volume, yeah.
Your
Now.
volume?
Yeah, now. How are you?
I'm good. How are you?
Good, thank you.
I'm wondering why my battery is not being used properly. Hold on.
Okay.
I'm gonna try this.
Oh, I'm early, 4 minutes.
Okay,
You want to come
that
back?
should do it. What?
You want to come back in 10?
What was it? No, you're fine. I
Okay.
wanted to check my battery on my phone.
Oh,
on
okay.
my computer.
Yeah.
It wasn't working very well, so I was like, what's going on? Okay. So I don't have anybody here but us this morning. I don't
It's
know
good
what's
for
going on with this computer. And I don't know anything about them, so we're stuck. All right, where's my
the other class have student now?
excuse me?
In the class you have student there?
Not now, there's nobody in here but us.
Oh, okay. No, because I see the area, it's not the class, right?
It doesn't say the class? Hold on, it
Yeah.
will.
No, I
When
see
someone comes in.
I see
There.
behind you, it's not our class, right?
Oh, you're not in my class. Oh,
Yeah.
no, I'm not.
Okay.
They're teaching a state board class over there
Oh, okay.
on Tuesdays and Wednesdays, yeah.
Yeah.
So I get stuck over here. I'm looking for my piece of paper here and my attendance sheet. Okay. Do you remember this sheet of this paper I gave you on Saturday?
Yeah, I want to ask you. Yeah.
Okay, we're gonna fill that in today.
Okay.
Okay, because I couldn't find it yesterday. I was like, where did it go? And I'm like, okay, well, I'll just wait.
Oh, okay. You know, I
What
want to
time
ask
is
you
it?
yesterday, but I don't want to confuse you, you know?
Oh, no. I had said something before in the morning. I think Sarah was in here and that's why I told her.
Oh, okay.
I'm freezing in here. Okay. And there we go. So I want to get everyone in here that's supposed to be in here. All right. Good morning.
Good morning.
I'm a little stopped up. Okay, let me get some roll sheets here. One, Sarah, Natalie. So Natalie, did you find out what's going on?
What do you mean?
Like when you're gonna move or?
Oh, no, it's just something that we're thinking about. We still would have to save up money and then figure out how we would get everything over there and all that. I just wanted to see if it was even possible to transfer my credits over to a different school. So it might not be until like the middle of the year. We're gonna go in March to like check it out and then see.
Good morning, Jasmine. Okay, that's what I was trying to figure out there. Because we didn't know what you were going to be doing.
Oh yeah, no, I'll be here still.
Have you checked the hours and stuff like that?
Not yet.
No?
Yeah, no, we haven't even got that far. We've just been kind of looking at places there, and then like I have a little bit of family there, and so.
Okay. I know everyone's kind of moving either there or to like the south.
Mhm.
It seems like they don't want to be in California, is what it is.
Yep.
I don't blame them. I don't either. If I had a job, I'd go someplace else. Okay, there's sorry. here. There's 6 of us, so. And LA. Okay. Nope. Okay, so we're just waiting here. I'm gonna have you guys get that paper out that I gave you on Saturday. I did find my notes. So we'll work on that this morning before I go into the rest of the lecture. Because I have to give you some credit on that. Jasmine, what's wrong? Why are you not letting me see your face? No sound.
I'm right here.
There you go. What happened? You don't like to show your pretty face?
Oh, my beautiful bed head. Oh, yeah.
That's okay. I started watching this stupid Netflix thing over the weekend, and it's rich Asian something. I don't know what it is, but anyways,
Crazy Rich Asians.
Yes.
I love
Have you
that
seen
movie.
that
It made me
thing?
cry.
I almost died. Okay, there's a lady on there. I want to wash her damn hair. She has never looked good the entire time I've seen her on that show, and she's supposed to be like the adult, you know, the oldest one on the show, and she's supposed to have all this like seniority and class and all this stuff. And I'm like, somebody wash her hair. And there's a part in there where one of the hairdressers, she's a well-known hairdresser here in LA. He goes, let's see what she uses it on her hair. He goes, because her hair looks like shit.
Wait, is it Guy Tang or
It
not?
does. Her hair looks terrible. It's so greasy. It always looks greasy. It's not attractive.
Wait, which hairdresser was it? Guy Tang?
Yes.
Okay.
Yes. That was the episode that they had like season 1 out. Have you seen it? Any of you seen it? I thought, oh, this is so dumb. I can't believe somebody is so petty on all the stuff that they were getting upset about and the money they were wasting away. They went into this grocery store. It was an Asian grocery store, and they're paying $15,000 for an herb, $25,000 for a fish. And his friend looks at him and goes, you paid that on the watch. Go ahead and pay for that. My mouth just dropped. Could you imagine? Oh yeah, I'll just write off $25,000 at the grocery store for one little item. No, not happening. Is everybody sleepy this morning or what? I know I was late getting on because I couldn't get my computer to do. I don't know how to get my battery to start working again because it just kept telling me my battery.
I mean, in my defense, Miss JD, I'm always sleepy.
Something
so-
about.
I was up until like 3 a.m. So
It's okay.
I'm
I
glad
just
that I
wanted
was-
to know if everybody kind of gets to those moods every once in a while.
I'm lucky I was even able to wake
I
up.
was shocked that no one was here because usually you guys are all waiting for me. So that's why I asked. I'm like, okay, but you'll be here tomorrow, bright and early. I'm trying to get. Did everyone get the homework done last night? Because I'm going to do that after. I did like part of your time cards already. And then I'm actually giving you guys credit if you're turning in last week's like a Valentine thing. But normally you're supposed to do that on the same day. So I just wanted to get it. You know why I didn't see yours, Jasmine, is because you did it on the paper, on the notebook. That's why I didn't see it.
But I got credit for it?
Yeah, but I didn't see it because it was on that note. You know what I mean? It was on your study guide
Oh, okay.
at the bottom.
Okay, I
Okay.
understand. Yeah.
All right. That's why I was like a little confused. Good morning, Diana.
Good morning.
My class is like getting smaller and smaller and smaller. It fills up and then it gets smaller. I'm like, okay. Oh. So, Diana, did you get this piece of paper on Saturday? Because you were here. Remember this one? The rules.
What was that?
Huh?
What was that?
Did you get the rules and reg sheet on Saturday when you were here?
I don't think I did. I know I was there, but I don't think I got that paper.
Okay, you might have gotten it from me like when you first started.
Okay.
Okay. So we're gonna go through these. They're like fill in the blank. So if you know where your paperwork is, you know, you could write it down and
Okay.
fill it in, or if you already have it, then you can, Just
Mhm.
keep it, because you're gonna need this for state board, because this part of the curriculum is not in the book. Okay, it's
Okay.
only when I hand it out, because each state is different and the textbook is for 50 different states. So the rules and regs and the sanitation are gonna be different for each state. Okay? You know, like some of the hours are changed too, because some of them you need less hours to grad, you know, to get your license, and others you need more hours. So it just depends. So Natalie, you don't have one, huh? Either, because you weren't here.
Have one what?
The rules and regs that I'm
Uh-uh.
talking about? Okay,
No.
I can go a little slow so you can try and make one up when we're going, because I gave it to the girls so you could fill it in, okay? There
Oh,
are-
you gave me like a. Let's think. You gave me something.
Yeah. Did I give you this one right here? It's like, it says rules and regs of the state on it.
No.
Okay. All right, so this part, like I said, is not going to be in your textbook, okay, because it doesn't list it in there. They don't list those rules because each state has to give you their own rules, okay? There we go. Megan Bradley, who's that? She got a new name? We'll find out. Megan, are you, hello? Hi, what, did you just change your name now? Did you get married and not tell us?
No, Bradley is my dad's name.
Oh, okay. I was like,
Yeah,
who's
there's
Megan?
Michael.
All right,
It depends
So-
on if I'm on my computer or my phone. Then
Oh.
it'll be things.
okay. So you weren't here either last week. So what we're going over is this rules and regs of the state. Okay, you might have gotten this when you first started from me.
I think
Okay.
I did.
You think you did?
I think so.
Okay. If you do, and you have it like near you, can you pull it out? Otherwise, I'm gonna have to ask you to kind of make your own little notes, you know what I mean? So that you have them. I was trying to tell everyone, there are 40 of these rules that we have to have for state. And a couple of them got changed anyway, so just the numbers on it from the first of the year. So I got waiting for one more person. Let's see where she's at. Because I haven't seen Tori yet. I'll get you guys in here. Do you have your notes near you at any chance, Megan?
Yeah.
Okay. You think you have it? Hang on, there we go.
It might be in my locker.
Huh?
It might be in my locker.
Okay.
I know that I've gotten that before.
Okay, well then, if you don't have it, at least write the answer, what I'm gonna give the girls, okay? So I'm gonna read the question, don't write the question if you have to, okay? And at least you'll have the answers when I give you the another sheet, okay? Tomorrow when you get in
Is
here.
it this one where is it the numbers where it's like where does something have to be hung in the reception area?
Yes,
And then you have to have a
that's
state
it.
issue photo ID. Okay, I have the answers.
Okay. Just letting you know, are we too loud? No, you didn't know. Oh, yeah. Do you know which one it is? Yeah. Okay. So we'll wait on her. I'll give her, it's 10 minutes after. Heck with it. I'm gonna go with class. All right. So these are gonna be the rules and regs of the state. Okay, 40 questions. So if you don't have the piece of paper, then at least write the answer down. Okay. So the very first question is, where are the health and safety rules to be posted in the salon? And it's the reception area. That's the answer. Reception area. Okay. Number 2, where are the health and safety rules to be posted in the school? It's going to be the reception area and the theory classroom. Theory classroom. No, I don't have that one. I just have back door. Yeah, it's still not getting warm in here. Well, it's gone up 2 degrees, but I think that's because the sun came through here. I'm gonna get a heater. I've never said those words. All right, number 3, what constitutes satisfactory proof of identification? Okay, this is gonna be state issued photo ID. Okay, and it cannot be expired, and it cannot be a paper copy. So you actually have to have the license. Okay, and your license needs to have your correct address on it. Okay, and if you don't have it on there right now, I suggest you change it so that you get your license with that on there by the time you get ready to take your test, because they won't let you in.
You
All
had
right.
it right too, Miss Janie, that it can't be expired.
Yeah, it can't be expired. And you know when you renew it or something and they give you just like a little piece of paper, you can't even take that in there. You actually have to have the hard copy of it with the photo on it. So the only other time I tell them to make sure that it's on there, if the, your address is off, or if you've like lost 200 pounds and changed your hair color, and you don't even look like that person. Okay, but other than that, that's the only reason. You just want to make sure that it's valid, okay, and it's got your current address. Because when the documents get sent to them, they have to match. Okay. All right. Number 4, what type of receptacles are used to hold soiled towels? A closed receptacle. Okay, a closed receptacle. Okay. 5, closed cabinets are used to hold what type of towels? Clean towels. Okay, 6, each disinfectant container must contain how much solution? And it's enough for total immersion. Okay, enough for total immersion, but it must have the solution must cover the implement. Okay, that's what they're telling you. Okay, 7, disinfectant solution must be available for use when? At all times. At all times. Okay, 8 says list 3 objectives that must be on an EPA registered label for disinfectants. Change the 3 to a 4. Okay, it's supposed to be 4. And the first one is tuberculocidal. Okay, and it's spelled TUBERCULOCIDAL. Okay. The next word is fungicidal. FUNGICIDAL. Okay. The next one's going to be virucidal. VIRUCIDAL. And the last one's going to be germicidal. GERMICIDAL. I'm looking at Connie's spelling, so she better have it right. So it's tuberculocidal, fungicidal, virucidal, and germicidal. Okay, those has to be 4 of them. Okay. Number 9 says, when should the disinfectant be changed? Once a week or whenever cloudy. Okay, once a week or whenever cloudy. So just for your future knowledge, okay, when you go into a salon and you get your hair done, your hairdresser have this little barbicide where she has her comb sitting in it. Okay, those are only supposed to be in the disinfectant solution, okay, which is that barbicide, 10 minutes. They're not supposed to sit in there all day. And they are also supposed to be rinsed off once they come out of that solution. So I've watched hairdressers just take it off, shake it like this, and then just start combing somebody's hair. And I'm like, what are you doing? They go, first of all, your combs are starting to like melt on the side because they've been in there for so long. It's a 10-minute, and that's it. Take them out. They don't stand there all day or for weeks. People think that they're a lot cleaner if they're sitting in there when they show up. I'm like, no. It breaks down the product. All right, number 10, describe a disinfectant container. A container with a lid that's labeled. Okay, a container with a lid that's labeled. Okay, 11. Where are disinfectant implements placed for storage? In a labeled clean container. Okay, labeled clean container. So that label should say new or clean. Okay. When it's ready to be put away for use for the next client, it should say new or clean on the outside of it. Okay. 12, supplies which cannot be disinfected need to be disposed of where and when? In the trash, okay, immediately after use. You don't set it down, half of it on the table to throw it away, okay? It has to go into the trash immediately. That's why when you're doing your state board, I'm like, trash, trash, trash. Don't put the papers on the table. Okay. 13, can implements be carried in your pocket or clipped to your sleeve? No, your tweezers are not supposed to be in your pocket, okay? That's a fine, literally. Okay, so you want to make sure if you need something to put them in, you know those little, you can buy them at the dollar store. They're like little lunch containers with a lid on it, like a Tupperware thing, but it's got a little slider on the top for like where they used to put a fork, okay? You can actually put your little scissors and stuff on the inside of it, and then you can stick your tweezers in the top part so they don't get banged around and start to lose their grip on there. But they're a great little box that you can keep them in, and it does fit just about anywhere, but not in your pocket. All right. 14, describe a professional appearance or attire. They're talking about your appearance, like what you look like, so they want you to look clean, okay? I've had this question asked to a couple of girls, and when English is not the first language, they get a little confused. They thought they were talking about their tires on their car. I was like, no, 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 no. Seriously, that's not even funny. That's exactly why she failed the test, is because she was answering things like that because she didn't understand a couple of the words. And it makes it very difficult if you are from a different country or you're learning a different language and this is your second one, you're like, oh my God, words, some of them don't translate well. Okay, all right. 15, when should hand washing be performed? Before serving each client and whenever necessary. So basically before and after, and sometimes during a treatment. But after touching hair, after throwing something in the trash, those are all times that you need to wash your hands.
You didn't say 14.
14, to
14,
describe
no.
a professional appearance. Yes, I did. I said clean.
Oh, clean. Sorry.
Clean. That's okay.
Yeah.
Okay, did you get the hand washing?
Yeah.
Okay. All right. 16, if you have a cold, when can you return to work? 24 hours after the fever breaks. Okay. 17, when is it safe to return to work if you have strep throat? This is 24 hours after treatment begins. 24 hours after treatment begins. Okay, 18, when is it safe to return to work if you have pink eye? This is a doctor's clearance. You have to have a doctor's clearance. One's not on here. Warts, the same thing, okay, which is called verruca, is a doctor's clearance on that also. Okay. 19, when is it safe to return to work if you have whooping cough? Okay, 5 days after the start of the coughing. Okay. 20, or excuse me, 20, yeah.
Yeah,
When is
20.
it safe? 19? We just did that one, right?
Yeah, now 20.
Okay. When is it safe to return to work if you have chickenpox? 6 days after start or when scabs appear. Okay, 6 days after start or when scabs appear, then you're not contagious anymore. Okay, 21. When is it safe to return to work if you have the mumps? 9 days after the start of swelling. 9 days after the start of swelling. I should breathe. Okay, 22. When is it safe to return to work if you have impetigo? And that's 24 hours after treatment begins. Okay, 23 is where do you place soiled towels in a labeled closed container or receptacle? Okay, a labeled closed container or receptacle. Okay, this next one has changed from what it was before. So it says, how long must the towels be washed? It's a 25-minute cycle minimum. Okay, it used to be like, I think 15 or something. Now it's 25. Like the side of the building. Okay, 25. At what temperature should the towels be laundered at? And it's 160 degrees. This number has changed also. It used to be 140. It is 160 now. Okay, we're going to go over to the other side, correct? Yeah. Number 26. Powders are to be kept in what type of container? Okay, a labeled clean shaker. Okay, they need to be like in a shaker container for the powders. Okay, liquid 27. Liquids and creams are to be kept in what type of container? A clean, closed, and labeled container. 28, all bottles should have what on them to disclose their contents? Labels. Labels. Okay, 29, pencil cosmetics are to be what before each use? Sharpened. That should be sharpened before and after use though. So add that after also in there. They're to be sharpened before and after use. $30, how do you remove only a portion of a cosmetic for use? Okay, either a cotton Q-tip or a spatula. Okay, and I'm going to give you something else to put in there. We can remove product from a larger container into a smaller one. Okay, once it's in that smaller container, you cannot put it back in the bigger container because let's say you have some left over, you can never do that. Okay, so once it gets into that smaller container from the large, that's where it stays. All right, 31, the treatment tables are to be covered with what? Clean sheets. Thirty-two, skin removal techniques are limited to which layer of the skin? The epidermis. Thirty-three, what does the law say about an accumulation of garbage? It's prohibited. You cannot do it. Okay, you've got to get rid of it. You can't save it for later. Thirty-four, how often is your license renewed? Every 2 years from the date you receive it. Okay, you can allow your license to let it lapse up to just before that 5-year mark. At the 5-year mark, they will make you take the exam over again, both the written and the practical. So you don't want to let it go by fast, 5 years. Okay, and then just add, I think, like a $25 fee when it's not paid on time. That's all. So it's going to cost you like $50 a year, $75 if you don't pay it on time. Okay. 35, what is the name of the governing agency for cosmetology or your aesthetics? It's the Board of Barbering and Cosmetology. The Board of Barbering and Cosmetology. That's who licenses you. $36, where is the governing agency located? What city? Sacramento. And 37 is, where's the testing facility for Northern California located? What city? Fairfield. There's only 2 in the state, one in Glendale and one in Fairfield. Okay. 38, what is the minimum passing score for the written exam for licensure? It's going to be 75 for practical and 75 for written. They are graded separately. It used to be at a time where you did higher scores on your practical, they would give you a couple extra points on your written, but they don't do that anymore. Okay. 39, are implements that pierce the skin allowed to be used? No, they're talking about a lancet. We're not allowed to use it. And 40, how are electric implements disinfected? Kind of gave you this one once before, but I'm going to give it to you again. Use a specific product and follow the manufacturer's instructions or directions. Okay, the specific product will be probably different for each piece of equipment. So that's why it says use a specific product and follow the manufacturer's instructions or directions. Does anybody need any of those repeated? You got them all?
Can you repeat 21 and 22, please?
Yeah. Okay. 21 was, when is it safe to return to work if you have the mumps? And it's 9 days from the start of swelling. Where'd you go? You still there?
Number
Okay.
3.
It's 9 days from the start of swelling. Okay. That's 21. And then 22 is, when is it safe to return to work if you have impetigo? And it's 24 hours after treatment begins.
Okay, thank you.
Uh-huh.
Oh, sorry.
Do you have a different one? that
Yeah,
you want me
number
to-
3.
Number 3. What constitutes satisfactory proof of identification? California, okay, photo, it's state photo ID. So since you're in California, it's gonna be California, either your driver's license or your identification card. Okay, they do take your passport if you want that.
No, I have everything. I have
Okay.
ID. Yeah.
It just can't be expired, okay? That's all.
Okay. Number 12, please. Trash and number
12,
12. Yeah.
okay.
Trash
It's trash, okay,
and-
immediately,
Oh.
immediately. You got to do it right away.
Number 30, please.
30 is, how do you remove only a portion of a cosmetic for use? Their cotton tip or a spatula? Like you can't stick your fingers in them, so you have to remove it with something else. And once that cotton tip or spatula goes in for that first dip, per se, okay, and you wipe it on your hand, you cannot re-dip it in there. If you wipe it onto another cup, you can use that again. But if it touches your skin, you cannot use it again, okay? Because then that means it's contaminated. You want to make sure that you're telling your clients to do that with their moisturizers or things like that. Any jar that they have to put their fingers in, the minute they put their fingers in it, they've contaminated the jar. Okay, then they put the lid in and the bacteria starts to break down because they have the bacteria on their hands. Even if they just washed them, it breaks down the product that they're using. Okay. Any other questions, you guys? No? You're scaring me, Diana, doing that face thing. Coming in like this. And then you go back, you come in like Okay, you guys got your smart notes out, your study guide from yesterday? Okay. And we should be on thyroidectomy, right? On page 433.
Miss Janie, are we supposed to bring in that paper that we wrote yesterday, or are we sharing it on Zoom?
Oh no, we could actually share it on Zoom today if you brought it. Do you have it in front of you guys?
But are we supposed to bring it into class tomorrow? Like, is that what
If
we were
you print it up
supposed
and I
to
can
do?
read it, then I don't have to worry about that, but we are going to still discuss it. So you can either discuss it today or you can discuss it tomorrow, but is everybody's finished? They should be like turned in yesterday.
I turned it in, but I did it in like writing, like I wrote it down.
Okay.
So,
All right,
I wrote
and
mine
everyone
down.
else do their, okay, so then you want to give it to me? You could just turn it in as you just wrote it out, but who wants to go first? Diana goes,
guess
I'll do it. You want to go first, Diana? No? Okay. Sarah, you want to go first?
Sure, let me find it really quick.
All right, has everybody else got theirs
Do you
too?
want me to just read it?
Yeah, you can read it.
Okay, so the procedure that I chose was the under eye tear trough filler or trough filler, which is like underneath the eyes. And it's a cosmetic procedure done to increase fullness and firmness of the skin under the eyes to give the patient a more youthful and more vibrant or less tired look. People who are good candidates for this procedure are those who suffer from sagging, loose skin under the eyes that give them a tired, sunken in appearance. Hyaluronic acid is the product most used for this injectable treatment. The hyaluronic acid, when injected in the area to be treated, plumps up the skin and promotes collagen production. The result is the patient's under eye area is filled in with significantly less indentation. The procedure can only be performed by a board-certified medical professional. And how it's done is the skin in the treatment area is disinfected, and in some cases, a local anesthetic is applied. The filler is injected into the area to be treated. Once the injection is complete, the medical professional or the nurse will lightly massage the area to evenly spread the filler. Recovery is fairly quick. However, the patient may experience some swelling, bruising, and or redness for the first 48 to 72 hours. It's advised to apply ice to the treated area for the first 48 hours to help with any discomfort. The patient may also be advised to lightly massage any lumpy areas that may appear right after the treatment. Some complications that can arise due to the procedure are headache, allergic reaction, infection, or blindness, although that's extremely rare. And the results typically last 1 to 2 years, and the average cost is anywhere between $600 to $1,300, depending on the geographic area, as well as how much filler is required to reach the desired results.
Wow. That's cheap though, if you think about it. And I was really worried about the length of time that it was going to last, because my lips are only going to last me like 6 months. Okay. That's not very much. Okay. And my lips cost more than that procedure, basically. Okay. Seriously. Yeah. That procedure's cheaper. And the other reason I asked is because Miss Sue had some work done. They had removed a cyst in her like on the side of her mouth. And it had a lot of tissue scarring underneath because it had been tried to remove a couple of times. But now a plastic surgeon went in and he had to fill it up. And it looks amazing. I'm like, and she goes, this lasts 5 years. And I'm like, what? Can that be used on your lips? She's like, no, not that one. She goes, this was just for like filling in areas. So I was wondering if it was the same one that you're talking about, but it's not. So I guess they have different types of fillers for different parts of the face.
Yeah,
But the
it
length of
said,
time-
yeah, when I looked online, it said that there's other products used, but hyaluronic acid is generally the most widely used one.
Mhm. That's a good one. Okay. How about you, Natalie? Are you ready? It wasn't that hard. She read it.
Yeah. Okay, so I did a follicular unit transplant, which is a hair transplant. It says it's a surgical technique that removes hair follicles from one part of the body, or like they call it the donor site, to a bald or balding part of the body, or the recipient site. Side effects can include infections, crust or pus around the surgical site, pain, itching, and swelling. You can also get like folliculitis, or loss of
That's not fun.
sensation. And visible areas of hair that don't match the surrounding hair or are noticeably thinner. And most people return to normal activity 2 to 5 days after the operation. And most will see 60% of new hair growth after 6 to 9 months.
Good. There's a place, Bosley Hair Transplant, basically. That facility is always asking for hairdressers to go over there and watch. And I go, I'd love to be able to go over there and just sit in there for like, I'd work 6 months so I get some education. I just want to know how he does it, because he would need someone in there to style the hair and to cut the hair once it's done, right? These men they're just feel uncomfortable going to like a regular salon now because, it's just recently had the hair transplant. So I'd love to see how they do that. It'd be kind of interesting. I'd feel like this. Ooh. And they're going to always tip. Males are always a better tipper. I don't know why, but they are, especially if they're tipping a female. All right, Jasmine, what was yours? She left me. We can't hear you. You are like muted, girl.
Sorry. No.
That's okay.
I'm looking for it right now. Okay. Okay, I remember it. Okay, so I did the I say I remember it, but I know the skin grafting.
Yeah.
So skin grafting is basically when you say like you have a burn victim or you had skin cancer and they needed to do surgery. It's to repair that skin to kind of make it look more normal. So it's just more of, I would say like more of a camouflaging kind of technique. But so there's two types of like skin grafting. It's like there's the partial, sorry,
Where'd you go?
I'm sorry, it's on my phone. Okay, so there's split thickness and then there's full thickness skin grafting. So the split thickness is basically you take all of the epidermis and then part of the dermis out, like to repair the skin. But this is usually done on larger areas of the skin, and it's taken from larger areas like the butt, the thigh, or the abdomen.
Okay.
And so that's usually what's it's, and then this one's like kind of used for kids, so as they grow older they're gonna have to kind of go back and get it done because their skin changes or something. And then there's the full thickness, which is where they take the epidermis and the dermis fully and they repair it, but that's for like smaller areas. So say like you got a really bad burn, like really like splattered all over here, that's what they're gonna do, and they're gonna take it from like the forearm or the buttocks or the abdomen to prepare that, and that one's yeah. So and then the precautions on like the cautions are like more of like you're going under anesthesia, so that's always dangerous because it's a surgical procedure, and so it's the anesthesia, and then after you run the risk of infection if the skin graft didn't go well, and you have to go to the doctor right away. And then some things to be aware of are like swelling, discoloration, redness, stuff like that. But after, if it's like a fully successful skin graft, it takes about 1 to 2 years to heal. So
Wow. You know, they can grow skin on a sheet, like take a piece of your skin and just grow a football field of your own skin.
that's crazy.
Having to do these grafts. Yeah, we've come a long ways in medical technology. All right. Araceli, do you want to do yours? That
Sure.
was good, you guys. I always like this part of the class. You get
I
to
did
talk.
the buccal fat removal,
Uh-huh.
also known as cheek fat removal or buccal lipectomy. It's a surgery that removes excess fat pads from the cheeks, creating a more controversial appearance. Patients with overly full, round, chubby cheeks remove the buccal fat pads to achieve a more sculpted and symmetrical facial appearance. This procedure can be performed by a facial plastic specialist, not a dentist. This procedure can be done at an outpatient surgical facility, and patients can return home the same day if treatment is done alone.
Wow.
Recovery time is about 7 to 10 days for the tissues inside the mouth to recover. Patient must maintain a soft or liquid diet for those days. They might recommend a special rinse to reduce infection. This procedure is done under, it's mostly local anesthesia, but some patients can go under. And it only takes about 15 to 30 minutes for the procedure.
Wow.
So what they basically do is, it's inside the mouth by the salivary duct. They make a little incision. They remove the fat with some tweezers, and then they do some stitches. Some of there's not really a lot of side effects except for if you go under, then, you know, for that. But you can have bleeding, infection, poor healing incisions, hematoma, or injury in the salivary duct. Price ranges starts from 3,000 and up.
Ooh, that's just scary. They're gonna take a piece of your skin with the tweezers. I'm like, you know, oh no, that's like chunk, like they do a biopsy or something.
So I read that a lot of people, that mostly people that lose a lot of weight, they do this, but it also with the time you age more. That's what I read some of the.
Wow.
Yeah.
Crazy. Yeah, because they're thin already. I mean, they've gotten thinner, and the elasticity usually of the skin doesn't kind of bounce back as well.
Yeah.
Okay, Diana, you ready now?
Yeah.
Okay.
Okay.
What was yours?
I did fat injections.
Okay.
Let me get. Okay. So let's see. I did like I don't know, explain it. I did it a little differently. So I'm gonna start with what it is. So fat is first extracted from another area from your body that you want to remove fat from. So either your thighs, your butt, or your abdomen, and you add it onto somewhere that you want to add fat into. So first it's sterilized, it's prepared, sterilized to be injected. And hold on. Let's see. Freak. Oh, sorry. I read it like the other way around. I'm sorry. Okay, so first I put, I like didn't read it from the beginning. So I put, there are various reasons on why people consider getting fat injections, and The two most popular are because they're wanting to get rid of fat to places where they do, and it's usually a natural way to create permanent. It's a way to create permanent volume to add onto your body. And the way that it's done is fat is first extracted from an area with your body with a syringe, either from your abdomen, your thigh, or butt, and then it's prepared and sterilized to be injected. The American Society of Plastic Surgery showed fat transfer to the face was up to 22% in 2017. One of the facts was that it's immediate results. It's also called, how to say it, but it's autologous fat transplantation or
micro, micro lipo injection.
Yeah, micro lipo injection, but I don't know what the first one was. Or usually fat grafting. And the benefits are to reduce appearance of laugh lines and acne scars. It also fills sunken cheeks, minimize hand wrinkles, and plump lips.
How long does that one last?
That will last 3 to 6 months usually.
See, that's just like my lip, so that's not worth it. If I wanted in certain parts of my face, no, it's got to last a little longer than that. I'm telling you, this costs more than that procedure that you were talking about. And they were filling in their eyes, okay? All right, Megan, did you want to go ahead?
Yeah, I did the lip fillers. There are two ways that lip fillers are most commonly done, and the first one is liposuction. So they use a needle to remove fat from out of one place on a person's body and move it to a different desired location. The second, which is the most common, is I don't know how to say it, Restylane.
Yeah.
It's a clear gel that is injected into the lips to give the desired shape or fullness. All the injections are permanent. They last about 6 to 9 months. Fillers can cost between $500 to $2,000 on the type of fill. Typically, one syringe is good for one person. The fillers do come pre-mixed with a numbing solution, but if a desired extra nauseous, like they can do it, but that's kind of how you get charged for, I guess. While getting it, feel like slight pressure, your skin is being stretched and reformed. There are any procedure. Typical bruising is normal. Some may experience more tenderness and bruising than others. Other risks include allergic reactions, infections, botched jobs, and vesage, which is very rare but can lead to tissue death in a serious case.
Wow. That's crazy, huh? You know, there's another way of doing that too, because since that one breaks down in the body, they've actually taken, this sounds really sick, but it's true. They take the foreskin of little babies and they actually make an incision in the lip and they insert it into that part of the lip so it plumps it up and it doesn't get broken down because the body just tolerates it. Okay, whereas the fillers, they all break down within months. So then they stitch up the corner. So it's almost like it's rolled into like a pipe cleaner, okay? And then it's injected in the lip and they stitch it back up. Because my next door neighbor got it done. I was like, really? And she's like, yeah. She goes, what do you think? I'm like, they're a little swollen right now. She had a very large mouth. I know it sounds funny, but they were very thin lips. So when she was done, she looked like Donald Duck. They were just like this, but they actually looked really good about 2 weeks later. It did look really nice on her. But that's another way of doing it. It's kind of creepy, huh? Okay, I'm going to save my little boys before he's going to have it done. No. All right, Yusra,
Yeah.
what did you do?
You know, I chose the facelift, and you know, this kind of treatment I noticed is several methods that we could use like during several time of season. It's like ablative laser. You know, this is the fastest and the most effective facelift method that help reduce wrinkles and tighten skin within 2 weeks. Okay, and we have the blepharoplasty. You know, this Yeah, this remove the, the eye bags,
Yes, the
and
skin around the eyes.
sometimes, yeah, and sometimes, remove the muscles too, because yeah, you need to be like, to tie the, and
Yep.
the fat, okay, and I see the what the name for the
How long is the recovery?
recovering?
Uh-huh.
I think 2 weeks, no
2 weeks?
more,
You
yeah.
think? I think it's a little longer than 2 weeks, but maybe.
I'm not sure about
I think about 3 to 6 months, maybe.
the laser 2 weeks. The laser.
Oh, just the laser one, yeah.
Yeah, the laser 2 weeks. The other one remove bags, not more, because it's like remove the fat and the muscle too.
Uh-huh. So that one's gonna take a little bit longer, I'm sure.
Yeah, it's I think longer. And I have it's like collagen. It's like
Uh-huh.
a moisturizing cream. It's like
It's a filler.
It's
Yeah.
named collagen peptidis, peptides,
Huh.
peptides. Yeah, that help the skin elasticy and moisturizing.
Oh, okay.
Yeah, and like some client, it's like have like scary from that treatment and machine, and we can give her like every 2 weeks like a natural facelift. It's like massage, massage,
Right.
tightening massage. Some people have like phobia, like machines, blood.
Yeah, they don't want to go underneath the knife
Yeah,
either.
we can take her like weekly client for
Uh-huh.
tight massage, like deep massage. You know what I mean?
Yes, I do.
Yeah.
The only thing with that though, you have to remember that gravity's gonna hurt them in the long run.
Yeah.
They can really tighten up all of that, but when they stand up, it's gonna go like, the older
No,
we
she
get.
needs
the
to
sooner
come
that
every
skin
2 weeks because it's not like
That's a good job. Guys, did I miss anybody? Did we all get a chance to talk? Yeah? Whoever's not talking is not talking right now. I'm just kidding. I'm glad you guys did a really good job on that. Okay, I'm gonna give you your break a little bit earlier, okay? But you will have until 5 after, okay? So you got 5 after 11, okay? And I'll see you back then. All right. Hello, everybody's coming back. Oh. Everybody else back? I got Araceli, are you back, hon? There you are. Okay, I'm waiting on Diana, are you there, hon? Good, okay.
Yeah.
Sarah's on a call, so we're good. So just to make sure everybody in here. Heat is not coming up at all. I've got it up to 80 degrees and you know I don't like 80 degrees on the temperature. Okay. So we should be on page 434. Nope, that's not where we're at. Hold on. 433, right? At the top we have, so let me get your second page up here to share the screen. This is where we should be. Right, syndectomy, this is our facelift. Did you have my screen yet? All right, so this is going to be the top of the page of that little box for the 433 page. Okay, it's on page 516 if you want to check your textbook. Okay, but this isn't the study guide we're working out of. So the results, okay, there are 3 boxes. So it's going to break it down into improved saggy facial skin. That's the first one. The second one is going to reduce the jowls. And the third one makes loose neck skin more taut. It's going to be tighter. Okay. So right after each one of those commas, you have a new box. Okay. And this is going to be recommended for individuals whose face and neck have begun to sag, but still have some elasticity in their facial skin, and they have good bone structure. Because if they don't have the elasticity, it's not going to look, it's not going to pull that great. So that means when it starts to stretch a little bit more, it's not going to look pretty. Okay, the side effects are going to be, and you have 3 of them also. It's going to be temporary bruising for number 1. Swelling is number 2. And numbness and tenderness of the skin is going to be number 3. Now normal, excuse me, recovery. Hold on 1 second. All right, sorry. So everybody get their side effects in there. The temporary bruising is 1, swelling is 2. Numbness and tenderness of the skin is the 3rd one. So your recovery has 2 now. Normal activities may be resumed in 10 to 14 days. And the second block is going to be complete healing takes place in 2 to 3 weeks. So you're right. I just see more people say out more than 2 to 3 weeks though. So the duration of this one's going to be approximately 5 to 10 years. So they say tiny tucks every so many years instead of waiting until you need a full facelift. But there's a full facelift and then there's one that adds the eyes also. So sometimes the eyes are included in their facelift. I'll leave that on the screen for just a moment so you can fill in your study guide. Do you still need the screen up, anyone? How you doing? Araceli, are you there, hon? Let's see her face on here. Is she back? Oh, there you are. Did you get this filled in, hon?
Yes,
Okay.
thank you.
And you're sorry you have yours too? No? Do you need the screen still up there? Okay. Megan just came in, so she might need this part of her book filled in. Megan?
Hi.
Do you need this part of your book filled in? It's on page 433 at the top.
No.
Okay. You okay, Natalie? All right. Okay, I'm gonna change the page. It should come up to our non-ablative ablative lasers. There we go. Won't come up just straight. Come on. Come on. Okay. This talks about laser resurfacing, which you're not going to fill this in just yet. Okay. I'm going to go back up here. It's moving to. Oh, it's coming up this. The laser resurfacing is below the ablative. Okay. So skip down to this area on your study guide where it says laser resurfacing. Do you see that right below the lasers? Everyone see what I'm talking about? Because it basically skipped over the non-ablative and it comes up a little bit later. So I'm asking you to skip the non-ablative and ablative lasers right now, and you're just going to go to the laser resurfacing. Okay. And this is what's going to be put into that area where it says laser resurfacing. It uses a beam of a highly focused light that vaporizes the upper layers of damaged skin at specific and controlled levels of penetration. Okay, they can stimulate increased production of collagen and elastin, minimizes fine lines and wrinkles, especially around the mouth and the eyes, and improves facial scars and pigmentation conditions. So all of that actually gets put into where your laser resurfacing is. Did I lose you, Diana?
No, I'm right
Oh
here.
God, what's it doing now? I didn't do that, I swear.
I know. I saw it too.
I didn't even change the page myself.
But I'm right
Come
here.
on. It's just jumping. Come on, go back. There we go. See, this is the part right here was what we were supposed to be working on. Okay, but it comes after this one. So here. Sorry. This one right here is what you're supposed to put in your book. Okay. But it's a little bit farther down on the page, and we'll come back to the ablative part. So let me know when you've finished all that with just a little thumbs up. Okay, Diana's got it. Okay, Araceli's got it. Let me see. Have you got this, Natalie and Jasmine? Jasmine, you should have it. Are you still writing, Natalie? Okay. How about you, Megan? Megan.
No, I did the study guide yesterday.
Okay.
Off of the Smart Note.
All right. So it's going to break down when it finally starts to turn the page. There we go. We're going to go back up to that non-ablative laser and ablative laser. Okay, and that's exactly what's get put into that box where it says penetrate the epidermis, usually without affecting it, to treat the papillary dermis below. Okay, do you know that there are 2 layers of the dermis? We talk about 5 layers of the epidermis, but there's actually 2 layers of the dermis. First one is the papillary and the second one is the reticular. Just an FYI, because they may ask you that. Now the ablative laser removes the affected portion of the epidermis to heat the papillary dermis, which regenerates the collagen. Okay, so you need to know about which one does what. Okay, one removes that affected area, the other one just penetrates without affecting it. Once they can get down into that dermis, it actually does start to help with collagen production. So when you guys get ready to graduate, your book will be handed in to me so I can check it. Jasmine, since you're almost towards the end, can you bring in your book? 'Cause you should
Yes,
have
I
everything.
can. Oh, I have everything done in it.
Yeah, that's what I said. It should be done. Okay. It's getting down to the days now, okay?
I have like, sorry, I'm like fixing a family crisis right now, so
Uh-oh.
I'm like going in and out of texting.
Okay, I hope everything's okay.
Yeah, hopefully. No, I don't even know. Yeah, I'm like, what, this week, Saturday is supposed to be my last day, but because I missed last Saturday, I think, what is it, next Thursday is gonna be my last day.
Uh-huh.
Yeah, because like, yeah.
Good.
Did you,
Next Thursday.
okay, next Thursday?
Yeah, because you're still, let me see, I haven't gotten out your time card finished for today or for last week yet. I'm doing that today.
Okay.
Using my next one on here, so I'll find out exactly how many hours you have.
Okay, cool.
But it looked like at the beginning of the week you had 5:45, right? Something like that.
Something like that, yeah.
Yeah. So once you get the 30 in there, you got another 15 or something, yeah. So it might be Thursday, yeah. The paperwork they probably won't give you until a couple of days. He may give it to you, but I don't even know if he's going to be here tomorrow. That's what I'm worried about. Okay. Don't panic. That doesn't mean he's not going to be here. Okay, just maybe later on in the day. Okay, so if they ask you to leave, they may ask you to come back. Okay, to pick up paperwork.
Okay, sounds
All right. Okay. So has everybody got this in there? Okay. Also, you know, the girls, my new freshmen. Okay. I had given you a little package, kind of like that had your grad plan on there. Do you remember that? I have Tori Ann, but it had graduation information for like graduation. Do you remember that? And then it had references in it. Do you remember now which one I gave you? It's like 4 pieces of paper. Okay, the first page you put your name on it. The second one you put whatever name you want on your diploma. Now, do you remember which package I'm talking about? I handed it out to the new freshmen. So I'll need those back tomorrow if you haven't turned them back in, okay? All right, under your laser resurfacing in your block down at the bottom, the results, you have 3. So you are going to put in there smooth, fine wrinkles. Okay, the second one's going to be softens lines around the eyes and mouth. The third one is going to be minimizes facial scars and uneven pigmentation. That's not on there. Okay, it minimizes facial scars and uneven pigmentation. It's recommended for the treatment of fine lines, large pores, hyperpigmentation scars, and wrinkles. The side effects are going to be, and you have 1, 2, 3, 4, 5. First one is temporary swelling. The next one is discomfort. And you have lightening of the treated areas. Increased sensitivity to sun and makeup, that's another one. And pinkness or redness of the skin. that may persist up to 6 months. So you have 1, 2, 3, 4, 5. Okay. Recovery is going to be normal activities may be resumed in about 2 weeks. And the second block on that one's going to be the redness fades in 6 months or less. So there are 2 on that one. It's a lot easier if you have to go back and fill some of these in because you missed them. Wherever there's a comma and there's more than one, that's what actually goes into the little blocks, okay? Just an FYI. The duration of this one is going to be long lasting, yet new wrinkles can develop with the natural aging process. So let me see what I got here. Sorry. Let me know when you guys have finished this area of the study guide. Did everyone finish their key definitions yesterday for their keywords? Yeah, you should have. All right. Does anyone still need this up on the screen? You need to let me know. Sarah, how you doing?
Good.
Do you still need this on the screen?
No, I'm good. Thank you.
Okay. So we're going
Miss
to
Jeannie, yesterday there was only 18 words, right?
I think so. Yeah, they're kind of short.
Okay. Yeah, it just
Okay.
seemed really short when I was doing it.
Yeah, just wait till I give you the one that's like 100 and something. No, I'm just kidding. There's 100, I think, in the skin, chapter 8, skin. But that's, that's to be expected if you think about it. All right, turn to page 434, which is the next page. Okay, and it goes into rhinoplasty, which is a nose job or nose surgery, excuse me. Okay, and it's basically surgery to reshape the nose. Okay, so it can alter the size and shape of the nose or narrow the span of the nostrils. It can change the angle between the nose and the upper lip. And it can also correct birth defects. So these are all definitions that you can use to put in where it says rhinoplasty nose surgery. I'm gonna pull this one up. Okay. Once you get that in there, then we'll go through the results. I'm actually going to give you today's homework assignment. It's going to be 14.1. Okay, and I'll cover that before we finish the class. Towards the end, I'll go through it to make sure everybody knows what they're supposed to be doing on that. I'll pull up the assignment. Okay. All right. Under the results, okay, number 1, it reshapes the nose. Okay. It's recommended for patients who wish to reshape their nose for cosmetic or reconstructive reasons. So it could be just trauma, could be a birth defect, any of those. The side effects, there are 3 of them. Temporary swelling is 1. Bruising around the eyes and nose, 2. And headaches are going to be 3. The recovery time is normal activities may be resumed in about 1 to 2 weeks. Avoid hitting the nose for at least 8 weeks. And then the second one's going to be complete healing takes place in about a year. I can say it takes actually longer than that because I had a friend of mine that had his nose done. And he was at a party and he was drinking and he ran into the door. And then his nose was on the side of his face. And so he's looking at me like eyes all swelled up. I'm like, what happened? I mean, it was funny but it wasn't funny. All right. He literally had to go back in and have the whole thing reset again. And I'm like, I thought that thing was set. He goes, I know it's not really permanently set for a year, they say. And I'm like, okay, whatever. But can you imagine just you hit something and then it's laying on the side of your face, literally. His nose was laying on the side. So the duration of this is supposed to be permanent. Okay, so I'd like you to fill that area in. All right, I've just got a couple of review questions before I go into this next part, okay? Because the next part is, it goes through explaining the different aesthetic procedures, right? And goes into wound healing and all that stuff. So that's gonna be like another area. But who could give me, I need 3 procedures that are performed by a dermatologist and 3 procedures that are performed by a plastic surgeon that's related to us in aesthetics. So I'm going to give you 1 for dermatologists, okay, which could be a chemical peel, okay, and a plastic surgeon. I'm going to give you 1. It's blepharoplasty, which would be an eye lift. So now I need 2, okay, 2 from each. I'm going to ask you guys to give me 1. I'll go around the room and let you answer it yourself. Jasmine, can you give me a procedure, okay, that a dermatologist does?
Yay, I can answer today, Miss Jamie. How
Yes, you get to answer
exciting.
today.
Okay, dermabrasion for the
Yep.
dermatologist.
Mhm.
And then you said for plastic surgeon?
Yep.
Did you say rhinoplasty?
Nope, I didn't, but that's good. That's another one,
Okay.
yes.
Yeah, so the nose job.
Okay. Megan, I always forget you, so I'm gonna ask you, let you answer this one. Give me 1 from a dermatologist and 1 from a plastic surgeon.
I guess lip fillers for the plastic surgeon.
Okay. But you can actually use that one for your dermatologist.
But
For lip
for
injections.
what about liposuction?
Oh, that's true.
Because they can't take fat out and like move it.
Yeah.
So I guess 1 would be for a dermatologist and 1 would be for a plastic surgeon either way. So the gel for the
Okay, I'll buy that
dermatologist
one.
and the liposuction and the liposuction for a plastic surgeon.
Okay. Natalie, what about you?
I'm like trying to go back and look.
The beginning of our study guide should have a couple of them. Like which
Yeah.
one's performed by what?
Um,
Just give me 1 of either one.
the fat injections.
Okay.
And then-
From
So that would be
dermatologist?
for, would that be for plastic surgery or would that be for?
Yeah, plastic surgery, yeah.
Okay.
Okay.
And then,
You don't have to get the other one. I'm gonna go around and get the other
Oh.
girls to answer them.
Okay.
All right, Sarah, can you give me 1 or the other? A dermatologist or a plastic surgeon? Are you still looking, hon? Sarah? I can't see you.
Sorry, yeah, I'm good.
Okay.
Thank you.
All right. How about you, Sarah?
Facelift.
Oh. Give me a procedure that's done by a dermatologist or a plastic surgeon.
What the name for the? Oh my God, that is name.
The laser resurfacing, is that what you're talking about?
No, the laser, not the other one. Laser. The ablative laser. The ablative laser.
Yeah, it's a plastic surgeon for the laser resurfacing.
Yeah.
So we've got chemical peels and Botox injections, dermabrasion and dermaplaning. Those are all like dermatologists. Plastic surgeons can do eyelid surgery, which is blepharoplasty, rhytidectomy, laser resurfacing, and rhinoplasty. So those are all like your plastic surgeon's procedures. Who can tell me what's the purpose of a chemical peel? Anybody know?
It's for to renew the skin cells so that a little bit faster, so then it brings up all the gunky stuff and it cleans the skin of the toxins.
Yeah.
It exfoliates.
Okay. So it exfoliates, yes, the surface of the skin. It promotes cell turnover and induces the desquamination, which basically means it's speeding up that cell turnover so the skin looks healthier. The desquaminization means shedding, peeling, or coming off in scales. And that's what ends up happening when you get a peel. It can improve skin tone and texture. You can smooth out fine lines and wrinkles. It can even take care of uneven pigmentation. Sometimes it can remove age spots, but basically it's going to improve the overall appearance of the face, right? Reducing that pore size. So it makes the skin look really nice. What does the term EMDA stand for? Anybody remember? EMDA.
Aesthetic manufacturers distributors.
Huh?
Oh, which one you said? Sorry.
The
I was giving you that EMDA.
It's the aesthetic manufacturers and distributors alliance. Got it. Okay. Establish procedural guidelines, right, to ensure the safety and the consistency and the use of our alpha hydroxy products that we use in chemical peels. So it's making sure that everybody follows the same guidelines. Okay. All right. Who hasn't answered one here? I need to know the difference between a deep peel and a dermabrasion. Anybody want to take that one? All right, what's a deep peel used for? No one
It
remember?
didn't use to get rid of like scars and stuff. It's like for like in more extreme cases, like a chemical peel.
Mm-hmm. So how about give me a side effect then, at least on a deep peel.
Skin sensitivity.
Yep, swollen.
Redness.
Let's see. Yep, peeling, right? What about dermabrasion?
Is that really a side effect if that's what it's supposed to do though?
Well, yeah, it's actually what actually happens to the skin. So it's during recovery, but they call it side effects when it's swelling. Temporary itching, yeah, it could be. I don't have another listing for it, actually. Give me possible side effects for dermabrasion.
Scarring.
Okay. This one can be like lightening of certain areas of the skin, right? Burning, itching. Oh, I said that word burning. Okay. Mild swelling, increased sensitivity to the sun. All of those would be, you know, dermabrasion side effects. Let me see. Trying to give you the rest of your homework, so I'm gonna figure out what I want to do with you here. Okay, I'm gonna hand out, or we're gonna go over the homework assignment for today. So you're going to finish 3.1. So what I'm gonna do is I'm gonna stop this share and pull up the homework so that you know what you're going to be doing. Okay, so give me 1 second here. I'll load this one back. Okay. There you are. All right, I'm going to share my screen with you. All right. So you will go back to your Learn screen when you log on. Remember, you're going to go to the clock first, right? Does everybody know how to get to the clock? So, okay, what's going to happen is you're going to go to Learn About Beauty on your window, your www whatever, and it's going to be Learn About Beauty, okay? And it's going to bring up your username and password on the Pivot Point website. Okay, hold on. Like, okay. This is what you'll see when you get past your username and password. All right, I'm going to scroll down on this page. Do you see where my cursor is right now, where it says Lab Session Tracking? Everyone see that? Right here? Okay, when you start your tracking, you're going to click on that, okay, and it's going to tell you, which should say you are now being tracked, okay. When you're finished doing your homework, you'll come back to that screen, which is on the home screen, okay, and it logs on for you, all right. It's now going to start clocking your time. All right, then you're going to go to the Learn screen, okay, this one right at the top, next to that pivot point right here, okay, and you're going to be doing 14.1, but now it's moving screens again. Like, what's going on here? All right. How about if we do this? I'm going to start you all the way over from the beginning. Okay. Still there? There you go. I know. I've stopped it. Okay. What I'm going to do is I'm going to move you over here and I'm going to bring up the lesson plan. So I'm going to go to my Google screen on this one. I'm going to click on it. Once I get this on, I'll share the screen with you, okay? Okay, I'm going to share my screen. Okay. All right. You should just have a blank screen up there. Can you see it though? It should be your like your search engine, okay, when you're doing this at home. All right. On mine, I have it set up so I can just hit pivot point, but you'll put in here, Learn About Beauty. Okay. And it will bring you to this screen when it comes up. It's so slow.
You said we're finishing 14.1, right?
Yes. Mhm.
For
That's all you gotta
the
be doing.
for the discussion, when we
Uh-huh.
post the comment, do we still have to send that to you in a text message, or can you see that?
Yes. Yes.
Oh, shoot. Okay.
All right. I know. Huh? All right. So you're going to get to this after you've done your Learn About Beauty. All right. You're going to come to this screen and you're going to sign in on yours. Okay. I'm trying to show because we have a couple new ones in here. All right. Come on. I swear. I want somebody make this work faster. All right. We are now going to be on what's known as the home screen where it says Pivot Point Lab. Right to the right of that, it'll say home. When it comes up, you will see a blue clock at the bottom. See it right there? Right down here. Everyone see it? That's where you'll start your time, okay? When you're finished your 4 hours, you'll come back and click on it again. That way it can track where you've been. All right, so after you've done your lab check-in, you're gonna go to Learn, okay? Because all your homework and your assignments and stuff are all gonna be on Learn. You're gonna go over to where the gray area is, okay? And I scroll down to the bottom, close to the bottom, and it says Salon Fundamentals Aesthetics. You're gonna click on that. Okay, and so this brings up all the lesson plans that we've been basically doing, but we need the very last chapter. So I'm gonna scroll to the bottom. There you go. Okay, and I'm gonna go where it says 4, because I have to go higher than 4. All right. And then I'm going to scroll down on the page. Push this side. And I'm going to go to 14.1. It says the medical. It's basically the medical environment. You're going to click on that right there. Click on 14.1. Okay, and then this morning what we did was the study guide or study slides right here. Okay, so you're going to scroll down and you're going to pass the SMART notes and you're going to do the discussion. In the discussion, you're going to click on this and it says the demand for medical estheticians is growing each year. The Bureau of Labor and Statistics expects the number of jobs for medical estheticians to increase by 38% by 2021. Why do you think that there is such a demand? Share your thoughts with the group. So basically you're going to fill in, or you can just put it on a piece of paper because you don't want to have to type it on here. It's hard for me to read it on there. Just put your answer on a piece of paper and take a picture of that and send it in a text message. Okay, does everyone understand? Don't write it in here, put it on a piece of paper. Okay, now I'm going to go back to my other page, same one we were on before, using the back button. All right. Okay, so we're going to scroll down to the assignment. So you're going to be doing the discussion, the assignment, and then you're going to be doing the challenge. So the assignment says, okay, create a short presentation on a TCA or phenol chemical peel, including results, skin condition recommended for, possible side effects, recovery, and duration of the results. Show before, during, and after images. Post your presentation to share with the class. So what you're going to be doing, okay, you're going to write down, you're going to search on the internet first, okay, and figure out the information they're asking you for. TCA and phenol peels, that's what you're going to look for. All right, you're going to look up the results, the skin conditions that are basically recommended for it, kind of like what we did here, you know, on filling in our study guide. We had to fill in the results, the side effects, the recovery time, right? But you're going to do it for a TCA or phenol chemical peel. All right, and they do have pictures in there, so if you can take a picture of it on your camera and then send that also. So you're not going to be like giving the presentation onto the computer. You will give it to me tomorrow, okay? In the class, you'll give that presentation. Does everyone understand that? It's not very hard to do, it really isn't. You're going to look up the TCA or phenol peels online, okay? Look up the results that they're going to receive, what they've been told anyways, okay? Some of them, like, I'm just going to take the dermabrasion. The results would be to smooth skin surface, improve the irregularities from the acne scars and wrinkles. So basically that's all you're doing, okay? You're going to look up side effects, the skin condition that it's supposed to be recommended for, the recovery time, and the duration results, okay? And then show pictures that you can find on the internet, like a before and after if you can. Okay. Once you do that, you'll bring that little package in tomorrow. That's your homework. Does everyone understand what that part of the homework is for? Okay, I need to get thumbs up from you guys if you understand what I'm saying. Okay, Jasmine, I got it. Megan, I got it. Diana, do you understand the assignment? Diana. Okay, see you, Sarah. What about Natalie? Do you understand what we're doing? Okay. All right. Yusra, where are you? Do you understand the homework?
Yeah, I think I'm done this one, 14.1, right?
No, but you're still going to do this assignment right here.
Okay, just assignment?
The assignment and the discussion.
Okay.
Okay, and
yeah.
You've probably already did the challenge is what you're talking
okay.
about.
Okay.
Okay, I don't know what happened to Diana. She's just not answering me. Diana. Diana. Okay. You're going to go back again now to this, I'm using your back button, and you're going to do the challenge, which will have questions on it. Okay. So I'm going to go back to that one page. Okay, and I'm going to scroll down Okay, where it says lesson challenge. Now this is the one you will do on the computer, okay? You will click on the lesson challenge. It's 12 questions. Okay, the questions will come up. All right, and they're multiple choice. Now make sure when you've decided on the answer, okay, and you clicked on something, that you don't hit a button even like on the side of it, okay, because it'll change your answer. That's what I'm trying to tell you. It's happened to me, I don't know how many times. So once you've clicked on this, move your mouse down here to get your next one. Because if you click by accident, like even in this area, not even on this right here, it will change the answer, okay? So be very careful. All right, once you've finished all of these questions, all 12 of them, okay, you're going to hit submit test, okay? That's the one that goes to the computer, all right? And that's how I pick up the answers, okay? But the other ones, they don't go to us just yet. I don't know why the program isn't set up for that, okay? So does everyone understand what they're going to be doing? Okay. I will put it on this zip so that you can have it again if you still don't understand. All right. Any questions, comments, or concerns so far about anything we've discussed today or the homework assignment? No one's saying anything. Let me just stop share here. There we go. So no one has any questions, huh? Who's like, I want out of here. Diana, did you ever come back? All right. I'm gonna let you guys. Uh-huh.
You know, when you talk now, you know, I check the discussion and I do it. I can do one more.
Yeah, I'll look to see you did
Yeah,
it.
I
You
get
sent
it.
it
And
in on a picture. I'll
I
look up
take
your
picture.
homework then. Okay,
I
I'll look
take-
up your homework. Okay.
Okay, please.
I will
Yeah.
look up your homework and see if it's on there because it will be on the zip.
And I
Okay.
can send for you the picture. Now I take picture from my computer.
Okay, but I will see if you turn that part of it in, okay?
Okay.
All
Thank
right,
you.
because you have a date on there so I can find it.
Exactly. Yeah.
All righty, I'll let you guys go. You were actually finished for today. Are you happy? You're like, yes. All right, I will see you tomorrow at 8 o'clock, okay? Don't forget to bring this assignment in the morning. Okay, the actual paperwork, all right? Okay, see you tomorrow then, 8 o'clock back door. Bye, guys.
Thank you.
Uh-huh.